I had the pleasure of presenting the data from the KOMET-007 looking at the addition of Ziftomenib to 7+3 in a phase 1 trial, large phase 1 trial that used Ziftomenib in a dose escalation fashion in combination with 7+3 in patients who were fit to receive intensive chemo and had NPM1 or KMT2A-r AML leukemia. And what we have seen in this trial is that the combination was actually safe. So the early mortality, the induction mortality was only 2%. Most of those patients were able to tolerate the therapy without significant grade 3 toxicities. Most of the toxicities that were seen were a reflection of the myelosuppression that we generally see with 7+3. So we did not see evidence of additional myelosuppressive complications. We also saw a very low incidence of grade 3 or higher differentiation syndrome or QTc prolongation, which are toxicities that we look for when we use menin inhibitors. But what was, I think, most interesting is the efficacy. We saw very nice early efficacy early on and subsequently in this longer follow-up from the study. So the 12-month survival in the NPM1 cohort was 94%. The median survival was not reached. The CR rate was also in the range of 94%. So all of these numbers, I think, are very encouraging, very high rate of MRD negativity. And importantly, the time for count recovery was also in line of 7+3, around 28 days. So I think these data suggest that the combination is safe, is tolerable, and has very good evidence for efficacy. And based on these results, we have an ongoing phase 3 trial called the KOMET-017, which is exploring 7+3 plus minus Ziftomenib, as well as a separate trial within the same protocol that's looking at Aza-Ven plus minus Ziftomenib. And hopefully those randomized trials will provide the confirmation for the results we just saw in the phase 1 trial.